Hi, I'm Dr. Darren Scott, and I've been practicing in Layton, Utah for the past 10 years. I successfully have treated peripheral neuropathy, fibromyalgia, diabetes, thyroid conditions, and many other chronic conditions. I also consult with over 800 doctors throughout the country. I'm here today to talk to you about how to end your struggles with peripheral neuropathy. If you're having burning, numbness, tingling, sharp pains in your hands or in your feet, this video is for you. Most likely you're watching this video because someone has told you that there is no cure for neuropathy. They've given you a pill and told you there's nothing we can do, learn to deal with it. Or they've done all these tests and the tests come back, they're all normal, and they tell you, well, they're normal, we don't know what's wrong, it might be in your head, or here, take this pill, or let's double this medication. If this sounds familiar to you, this video is for you. If you're tired of running from doctor to doctor, playing Russian roulette with the medications that just don't help you, in fact, you'll never be able to drug your way out of neuropathy, and you are tired of the medical merry-go-round, this video is for you. You're going to hear some things tonight that you've never been told before. In fact, I'm going to tell you some things that your doctor's never told you before. Now, the first thing I'm going to tell you is there is hope for you. You don't have to live your life like this anymore. Now, what I want to do is explain what neuropathy is, how you get it, and then what makes us different than any other doctor that you've been to. Now, neuropathy starts with numbness and tingling in your hands and your feet. It is a progressive condition, which means it will get worse unless you get it treated. Over time, the symptoms will go into your arms and into your legs, into your torso. It can even start giving you coordination problems. It'll give you, you can stumble, you can have falls, all of this from nerve damage. Now, in fact, have you ever been woken up at night because of your neuropathy symptoms? You're not alone. You're not the only person that's had these type of symptoms, and there's many other symptoms as well. Now, what we're going to do is let's explain how you get it. Out of 20 million Americans that suffer from this progressive condition, 10 million are caused from diabetes. Some of the other common causes of neuropathy is cholesterol medications, chemotherapy treatment, chemical exposures, and many more. Now, how do we treat it, and what makes us different than every other doctor that you've been to? We treat it neurologically and metabolically. Functionally, that is the difference. It's like your right hand and your left hand. You got to do both. Now, you're watching this DVD because you or someone you know is suffering from neuropathy. I'm here to tell you no stone is left unturned to find the exact cause of why you're suffering. Now, I'm here to tell you again, there is hope. There is treatment for your condition. But I also must say it's very difficult to treat it, and it's not easy. Now, you must get every piece of the puzzle or you're not going to have success with the neuropathy. Also, this program, if you qualify, is a big commitment. You're going to have to take responsibility, and you're going to need to make some changes. So, let's talk about how we treat it. Metabolically, neurologically, first thing we do is we get specific lab panels. Now, I know what you're going to say. I hear it all the time. Yes, but I already have all the lab panels. They're all normal. Yeah, I understand that, and here's why. There's a difference between lab value normal and functional value normal. Your body functions at a certain range, and then there's a lab range. For example, your glucose level is normal between 70 and 120 or 115. But what should your body function at? It's more narrow. It should be 85 to actually 100 is where your body functions at. So if you're sitting at 105 or 110, the report comes back there is no age, so there's a normal. Guess what? They're going to say you're normal when you're really pre-diabetic. Now, because you're on the borderline of the labs, that is why we need to do additional labs to find out exactly what's going on. Now, we're going to do a complete metabolic panel, which means we're going to do a CBC with autodifferential. We're going to do a thyroid panel. We're going to do a lipid panel. Now, if you're suffering from neuropathy, your liver, your gallbladder, your white blood cells, your red blood cells, all of these internal conditions can be affecting your neuropathy. Next, we're going to order a sensitivity test. I'm going to check if you're sensitive to gluten, to yeast, to milk, to eggs, and to soy. Now you may be sitting there going, well, what is gluten? Gluten is a natural peptide in wheat, oats, and barley. And there's a huge link between gluten sensitivity and neuropathy. Have you ever heard that? Probably not. If you're sensitive to it, it could be making you worse. But you only really know until you run the test and find out. Now, what kind of symptoms can you be having because of these sensitivities? You can have nausea, fatigue, chronic pain, chronic tiredness, bloatiness. There's a ton more of these. All right? So the next test that we do is we'll order an ASI test. This stands for Adrenal Stress Index. And it's going to check your adrenal glands. Now, they sit right above your kidney, and if those aren't functioning, it could be making you worse. Now, the other test we're going to order is an immune panel. Now, it's very likely you could be suffering from an autoimmune problem because your immune system is attacking your nervous system. Now, we're going to find out if you're Th1 or Th2 dominant. Is anyone telling you this before? Man, I don't think so. You're just getting medications. Now, you look up to some of the side effects of those medications, and it's pretty scary. Now, if you're Th1 dominant, that means you have an active antigen like parasites, bacteria, heavy metal chemicals. Now, it really could be an immune problem that you have, not a neuropathy problem. We will check your CD4. We'll check your CD8 ratio. Now, again, is anyone telling you this? I have to say not. Now, you could be having leaky gut syndrome, which is caused by another medications. Now, we're going to check to see if you have any of those things. We're going to see if you have inflammation. We're going to check your immune panels. Now, once we get all the tests and we get the results, we analyze them. Then we'll know exactly, without guessing, what condition you actually have and what proper treatment you're actually going to need. Now, what kinds of treatments do we provide? First off, we use glutathione. It's the mother of all antioxidants. We do oxygen therapy. It is fuel for your brain and for your nerves. We're going to do exercise with oxygen therapy. It's actually been proven that every year after you're 25 years old, your ability to utilize oxygen goes down by 1% every year. And this treatment has been clinically proven to actually improve your ability to utilize the oxygen that you breathe. Now, we may recommend spinal decompression. You very well maybe have a nerve pinched or having pressure on a nerve in your back or maybe in your neck that we could cause in your symptoms. Now, if that is the case, then we will make a proper treatment protocol that may be spinal decompression, maybe some normal chiropractic adjusting. It just depends on your condition. Now, we also use an FDA Approved Device that we use that will actually help rebuild your nerves. What I mean is it's going to help fix the damage that's already taken place from the condition that you have. And it's going to help heal them. It's actually been proven it will help wake the nerves back up. We also use brain-based therapy. You could be having a problem with your brain. One side of your brain is firing or out of balance with the other side. And we use brain-based therapy to help balance that back out. We may recommend bioinjections. Now, don't let that scare you. It's not a steroid injection, and it's not big, long needles. They're little needles, very small needles, smaller than the hypodermic needles you may have if you're a diabetic. Very small. We go just below the skin in the legs or in the arms to help give and inject a natural medicine that will help rebuild the nerves. In fact, Dr. Oz spotlighted these injections on his program not too long ago. Now, once we've run all the necessary tests, then we'll know how to successfully treat your condition. Now, what I want you to do is think about this for a second. What has it cost you? What has it cost you in your relationships, in your job, in your happiness? Now think about what your life would be without having the problems that you have now. And let me ask you finally, what is that worth to you? Now, if you're serious about fixing your problem, you need to come in my office. I do want to warn you, though, if we accept your case and we accept you as a patient, you will have to make some lifestyle changes. There's no question about that. If you're gluten sensitive, you need not to take gluten or eat gluten. It's just that simple. If you're not willing to make these changes, this is not the program for you. There is a big commitment, lifestyle-wise, time commitment-wise, and there is a financial commitment. Your insurance is only going to cover a small portion of this treatment. Okay? It is a commitment. But if you're committed and you're serious about adding the value to your life, it is worth it. Now here's what we do on your first visit. We'll do a complete neurological examination. We're going to find out how bad the damage is to your nerves. We're going to find if you have any permanent damage. And we're going to also maybe take some x-rays. We'll only take x-rays if we suspect that you may have some kind of a structural problem with the nerve in the back or in the neck or something like that. Then we'll also perform a surface EMG computer scan. That's going to evaluate your nerve function. By the way, all these tests are painless. Then after we've done all the tests, now you'll be scheduled for your second visit. Okay? In that second visit, I'll sit down with you. I'll discuss with you my exam findings, my x-ray findings, and we'll go over all the labs that you may have sent to us from your other doctors. Now, and I will tell you at that time if you qualify for this program. Now, it is recommended that your spouse be with you both visit. Your first visit, your exam visit, and then the visit we discuss your report of our findings of what we found and what we can do to help you. Now, I realize that time is hard, schedules are difficult in our lives. So at this point, I do, at a minimum, require the spouse or the loved one at the report of findings. Now, why do I require that? Here's why. You need support. This is not going to be an easy thing to go through. They're going to need to be there for you. Okay? They need to know what kind of problem you actually have. In fact, half the time, my patient will sit there and look around the room and say, see, I'm not crazy, I'm not crazy. Because they almost feel like that sometimes. And they say, man, there really is a problem. And finally, someone's actually figured it out. Now, lastly, don't forget to get us any labs you already have done in the past 3 months. In fact, give me any of your most recent labs that you have, even if it's over a year. Let's get the most recent labs. Now, when you get the labs in, we're not going to redo any of the labs that you may have already had if it's within the 3 months. Okay? And please get these lab test values to us before your appointment. Now, here's the easiest way to do this. Call your doctor's office and just tell them, will you please fax my lab results to this fax number? That fax number is our fax number. And you just have them fax it straight to us. They're always really good about getting us the labs. It's not a problem. So I'm looking forward to seeing you and hoping that you qualify for this neuropathy program, because I do know this, it will change your life and it will add value to your life. And now I've also included some patient testimonials at the end of this video, so you can get an idea of what patients have been through our program. Just to let you know, it's not all of our patients, it's just a sampling of them. But that way you can see what their experience has been with us, how it's changed their lives for the better. Because I see patients how they were when they came in, and I see how they end up at the end. And it is a wonderful process to see the change in these people's lives. Because not only do we change the neuropathy, we change, because we're treating them, we change all the 10 or 15 other problems that they may be dealing with that they didn't tell me about. Now I'm looking forward to seeing you, and I'm Dr. Darren Scott.